Welcome back, everybody. As you know, coronavirus, that pandemic is putting pressure on healthcare systems here in America at this point. Joining us right now is our next guest. He's the leader of Inova Healthcare Systems in Northern Virginia. They see more than 2 million patients annually. Dr. J. Stephen Jones is the president and CEO of Inova Health Systems. And Dr. Jones, thanks for being with us today.
My pleasure. Good morning, Becky.
Let's talk a little bit about what you're seeing. Here in New York, we're getting stories. There was one in the New York Times today about Elmhurst Hospital in New York City. One of the doctors there described the scene as apocalyptic. There were 13 deaths there on a recent day, just in one day from coronavirus. Obviously, they are facing some overwhelming and very straining situations. What are you seeing in your systems at this point?
Well, it is heartbreaking to hear that there are things like that going on anywhere in the world, let alone our own country. And so our thoughts certainly go out to any of those who are in that situation. We are in significantly better shape right here, at least at this point. When we talked what feels like about 2 years ago, which is, I think, less than 2 weeks ago, what I had said was that we were prepared and had seen our first patient. And what we've seen since then is that we do have community spread now in the Washington, D.C. area. And, in fact, most of our exposures have been through the community and not through some of the early things like travel or in healthcare. We have seen that our people have done exactly what we would expect, which is they practice what they've spent their whole careers being ready to do, which is to take care of people who are critically ill. As you know, coronavirus is not unique in many aspects of its care. It's just intense critical care for those few who do need it. And fortunately, we've had adequate capacity to be able to do that so far and do it very well.
Dr. Scott Gottlieb, the former commissioner of the FDA, told us yesterday, I believe, that he is worried about pockets, including the area in Washington, D.C. and surrounding area. That's where you operate. How worried are you, or is this a situation where you think the steps that are being taken at this point could actually bend the curve effectively?
Well, we are certainly hopeful of that. I think we have to be prepared to assume that that may not be the case as well, of course. And so we make no assumptions on how quickly this will be over or how much the curve is flattened. One of the key things with any of the predictions is this is a disease with less than 4 months of tracking data. So unlike models of things that you can follow over decades or other diseases, this is a 4-month-old disease. So we make no assumptions on that, and we'll be prepared for, assuming the worst.
Where do you stand right now in terms of supplies when it comes to testing kits?
Yeah, we're still in good shape on supplies. I think it's interesting. I was walking in the halls in one of the hospitals on Monday morning, and someone asked me, "I've heard we might not have enough supplies," and I looked and said, very accurately, we absolutely have enough supplies. We don't have enough supplies to use them unwisely or to squander them, and so we've been very meticulous about make sure that at the appropriate times we use all of our, whether it be PPE. Personal protective equipment. I think it's probably becoming a well-known term at this point in the public, and then also the testing kits. With the testing kits still being probably our most significant supply challenge, and the testing situation has clearly been a significant limitation, including that we have a lot of times where we have to use PPE because we don't have tests back to know whether the patient truly needs to be in that type of isolation. And so the quicker we can get that moved forward, it's not so much that it changes the management of patients. It changes how you deal with them, including PPE, isolation, et cetera.
I'm sorry, what's PPE stand for?
Personal protective equipment. It's probably been the biggest focus for many health care systems. It's the issue that hospitals that you mentioned are now having because they don't have enough, just masks and gowns and things to protect themselves. So, one of our highest priorities in medicine anywhere, including Inova, is protecting our own team members who are taking care of the patients, and that's critical that we do what we can to assure that we're able to do that not only now but however long this goes on.